Hello, I'm Sue. I'm the matron of the maternity ward and antenatal clinic at Gloucester Royal Hospital. I just wanted to spend a little bit of time with you today to talk about the visiting restrictions that we have in place currently relating to COVID. Before I do that, I want to say how grateful we are and how thankful we are for your understanding and your flexibility and adaptability with your visiting slots and anything to do with your pregnancy during this difficult time for us all. So first of all, if I can talk to you about birth partners and who is able to come with you during this exciting time. We realise that you want people with you to support you when you're here having your babies, and we know that it's difficult with the restrictions that we're not always allowing the number of people you'd like to be with you. So we do at the moment need to stick to one birth partner for your birth. The reason behind this is that we need to remain with the 2 metres social distancing. Things have changed out in the community and the social distancing has been reduced to 1 metre plus. But here in healthcare settings, it needs to remain at 2 metres to ensure we're doing our best to keep both yourselves, your families and our staff safe. So we've been looking at our birthing rooms and seeing how we can adapt them to allow you to have the people with you that you want during your birth. Unfortunately, to maintain that 2 metre distance, we do still really need to restrict that to just one person at the moment. That birth partner, we would like them to make sure that they are feeling well before they come into our hospitals. They shouldn't be displaying any of the signs and symptoms of COVID, and they will be asked those questions when you arrive in our hospitals. If they are well, then we also ask them that they would wear a face covering at all times, and that's slightly different from the previous information that we gave you. But from now, we would like all visitors into the hospitals to wear a face covering from the moment they enter our hospitals to when they leave. And that may seem a little strange when there's only yourselves in the room, perhaps on the postnatal ward, but what we have to remember is that we need to try our best to keep both yourselves and our staff safe. When you're in labour and on our delivery suite or our birth units, we also ask that your birth partner remains in the room with you the whole time. So if there are things you think you may need, if we can ask that you make sure you bring those with you when you initially come, rather than your birth partner having to come in and out of the room and leave the ward space. If you can bring as much as you can with you so that we can minimise the movement within the unit, that would be amazing. We also have to ensure that once you've had your baby in the delivery space, that your partner can stay with you for up to 4 hours or until you are transferred to a postnatal space or you go home. We're still just trying to finalise the last details about partners being able to come with you for your ultrasound scans and antenatal clinic appointments. We're hoping by the middle of July we will have some more information to share with you about partners coming along to scans. So please bear with us. We're doing our very best to make sure that the same as when you're here giving birth, that our scanning rooms are safe, both for yourself, your partner and our staff. The same things apply in that we will be asking your partners whether they are well, and as I said earlier, they shouldn't be coming into our hospitals if they have any of the signs and symptoms of COVID. We will also be asking that both of you wear a face covering during the scan. But we just need to get those last final details agreed. So if you can bear with us just a little bit longer, then hopefully we will have some more information for you very soon. With regards to your antenatal clinic appointments within the hospital, so not with your community midwife or in GP surgeries, but within the hospital, we're also working on that as well. So again, we have to ensure we're maintaining the 2 metre distance, social distancing, to keep us all safe. And we're just looking at how we can arrange our rooms and change around our assessment centres so that we can go ahead and ensure that's safe before we invite your partners to come along and join you. So again, please bear with us while we're working on making that as safe as we possibly can. Hopefully that will be in the fairly near future. We don't have a date yet, and it depends on any changes from government or trust guidance. The last thing I would like to talk to you about is our maternity wards. As the matron of the maternity ward, I need to be absolutely sure that our space is safe to welcome your partners back onto the maternity area. So to do that, if we think about the induction process and the fact that we have up to 8 inductions on the ward on any given day, I still need to be sure that I am able to socially space, keep that 2-metre distance for all of you. So due to that, what we thought would be best is if we invited you to bring your partner with you at the beginning of your induction for that first hour and a half when we are familiarising you with the ward environment, for you to meet the staff and for your partner to meet the staff and ask any questions they have about the process and about what will happen, and to just help your partner feel confident that when they go, they've been cared for, they've had an opportunity to talk to us, and they feel they're able to leave the ward environment with us caring for you. After being with us for an hour and a half while we start your induction process, we will ask your partner to leave. The reason for this is, as I explained, we have up to 8 inductions of labour a day on the ward, and we need to be sure that we can maintain that social distancing. So that might seem a little strange that we're asking your partner to go home, and then you may, on some occasions, go into labour quite quickly and they have to come back fairly shortly. But this is the only way we can maintain the social distancing to do our best to keep you and our staff safe. So we do apologise for that, but there is the reason behind it, and we hope that you will be able to work with us to make sure that we keep you as safe as we possibly can, until your labour requires you to be transferred to either delivery suite or the birth unit here in Gloucester. Once that time comes, your partner will be invited to come back and join you in that environment. They can stay with you the entire time that you're on our birth units or delivery suite while you're in labour. And as I said previously, for up to 4 hours after your baby's born or until you're transferred back to our postnatal areas. We feel this gives you some time to greet your new family before we need to transfer you to our postnatal area. So when you arrive on our maternity ward, having had your babies, we will give you a time slot for your partner to come back and visit us. We are sticking to the same visiting restrictions within the whole trust, and that is 1 visitor per day for 1 hour between 2 and 6 p.m. So we will give you the time slot that your partner can come back and spend time with you and your baby. During this time, as I said earlier, it is an expectation that your partner will wear a face covering the entire time they are on the ward. Even if you are in side rooms and just the 2 of you and with your baby, it's still an expectation that your visitor needs to wear a face covering throughout that time. Thank you for doing this for us. I really want to stress how important it is to us here at Gloucestershire Maternity that you feel you can get in touch with us if you've got any questions or concerns. We are here 24 hours a day to look after you. Our midwives and doctors are here waiting to answer your questions and support you. So please, if you've got any concerns or worries, don't hesitate to get in touch. You can contact your community midwife, or you can contact us here at the hospital on our maternity advice line, and that number is 0304 2 5541. All of this information will be available on Gloucestershire Hospitals NHS Trust social media pages. It's also available on Gloucestershire Maternity Voices partnership pages, and the information relating to COVID and any changes that we're making, not just about relating to visiting, will be available on the maternity pages on Gloucestershire Hospitals website. Thank you.